Hi. So we are often asked, how do we choose between a dermal filler and fat grafting? My name is Dr. Arun. I am a fish plastic and cosmetic surgeon. So we are often asked by many of our patients that we would like to augment some part of our face. What should I choose between a filler and a fat grafting? So let me first try and explain you uh, when do we go ahead with a filler or with a fat grafting. So as we start aging, so we start losing volume from our face, from various areas like the cheek, the jowl starts moving down, we start getting nasolabial folds, we start losing volumes in the temple, but then many other areas we start losing volume. So the only way how to improve onto this is by augmenting those areas or adding certain things which can, kind of volumize those areas. Dermal fillers, which are basically made up of hyaluronic acid, or nowadays we have something called as a hybrid fillers, which are a mixture of hyaluronic acid with calcium hydroxide. It can be used to place in certain levels of the skin or deeper down onto the bone, which can augment that area. So we have syringes of fillers, which we just take it and inject it. So hyaluronic acid actually lasts anything between 6 months to 9 months to say 12 months. And they can be placed immediately if the patient walks into us. We have a syringe of 1 ml which we can place it on, say, on the bone or onto the different levels of the skin so that it can augment that part of the facial structure. It can improve onto the volume of the lips, it can improve onto the nose, it can improve on the chin, it can improve on the cheeks, it can improve on the temples and many other areas. So the advantage is like it can be immediately done, it's a non-surgical or minimally invasive procedure, and the downtime is very low. So when we talk about fat grafting, so we harvest fat from another part of the body, say from the low part of the abdomen or from the medial aspect of the thigh, and we try and we process it and we put it onto the areas where we want to augment. Now, why do we choose fat is basically because of its longevity. It lasts for much more longer time. The second advantage of fat is that you can harvest as much as possible. We have a lot of fat and there is no cost involved in it except for the surgical aspect and the skill of your surgeon. While each syringe of filler costs you money, the fat I can harvest as much as I want and I can place it in any part of the face. It can be 5 cc, it can be 10 cc, it can be 20 cc. So what are the disadvantages of the fat? The only disadvantage is that it's a surgical procedure and you need to have a downtime of about 2 to 3 days and the patient is absolutely fine beyond that. Another advantage of fat grafting is that when we take the fat, what we do is the fat is actually made to stand so that we can separate the different parts of the fat like the blood and the tumescent solution, and the fat is taken and injected on as increasing the volume. So we can process this fat into microfat and nanofat, and since the nanofat they contain stem cell, they can be utilized to improve onto the quality of the skin. So nanofat today is very commonly used in cases of facial rejuvenation, inducing collagen, in cases of scars, etc. In between the macrofat and the nanofat, we have something called as a microfat, which are small globules which can be utilized in areas like the tear trough. It's very good. In the lips, it is very good because the granules are very small. In other areas like the cheeks and on the buccal mucosa, in these areas we need bigger volume, so we use something called as a macrofat, or the fat directly which is harvested and separated out. I personally feel if it is like for the nose or for the lips, it's very simple. We can go ahead with the dermal fillers. While if I want to augment other areas, I want to rejuvenate the skin, I think a fat is much more superior and it lasts much longer. Now coming to the part of how much time it lasts, it is often seen that about 40% of the fat actually does not survive, and anything beyond 3 to 4 weeks if the fat survives, this is what it survives for a long period of time. So we usually tend to overfill the area by say about 20%, so that we know that even if we lose a volume by say 30% or 35%, we are coming back to what actually we desire. So these are the basic differences between a fat and a filler, and every individual is different and every indication is different. We can always help you out to understand what would be better for you. You can please let us know, get in touch with us, and we'll be more than happy to help you out to know what exactly would fit or suit you. Thank you so much.